Which of the following viruses is responsible for infectious mononucleosis? A. Parvovirus B19. B. Herpes zoster. C. Epstein-Barr virus. D. Cytomegalovirus. The answer is C. Epstein-Barr virus. Infectious mononucleosis is associated with infection by Epstein-Barr virus, a form of human herpes virus. Cytomegalovirus is associated primarily with congenital defects. Parvovirus B19 is the cause of Fifth's disease, also known as slap cheek syndrome. Herpes zoster is the virus responsible for both chickenpox and shingles. Epstein-Barr virus belongs to the family Herpesviridae and is the causative agent of infectious mononucleosis, Burkitt's lymphoma, and undifferentiated nasopharyngeal carcinoma. Infectious mononucleosis characteristically produces a marked lymphocytosis involving almost all of the lympho-reticular tissues. This leads to hepatomegaly, splenomegaly, lymphadenopathy, and lymphoid hyperplasia of the oronasopharynx. The peripheral blood smear contains atypical lymphocytes of the Downey 2 type. It is generally a self-limiting disease. However, it can cause a severe protracted illness that can at times prove to be fatal. Patients with an unusual immunodefect known as the X-linked lymphoproliferative syndrome frequently have overwhelming EBV primary infections, which can be fatal in the majority of the cases. Zika virus is primarily transmitted via what route? A. Mosquito bite. B. Oral fecal. C. Respiratory droplets. D. Tick bite. The answer is A. Mosquito bite. Zika virus is primarily transmitted via mosquito bite, EDS. However, it can also be transmitted by sexual contact and it can cross the placenta, allowing an infected mother to pass the virus to an unborn child, who is the biggest killer on the planet. 1 million deaths every year. The most deadly animal in the world is the mosquito. It might seem impossible that something so minuscule can kill so many people, but it's true. According to the World Health Organization, mosquito bites result in the deaths of more than 1 million people every year. The majority of these deaths are due to malaria. The World Health Organization estimates that between 300 and 500 million cases of malaria occur each year, and a child dies from malaria every 30 seconds. Aedes mosquitoes are daytime, sunup to sundown, biters but will sometimes bite after dark, when there is illumination from outdoor lights, or when they get indoors. These mosquitoes can normally be found resting in dense shrubbery during the day where the humidity is high and where they are least affected by the hot sun. They transmit Zika, yellow fever, dengue fever and chikungunya. Anopheles mosquitoes hang out in the lower levels of thick plants and especially tall grasses. They are active during the evening and night hours. They are referred to as leg or ankle biters because of their low-flying preference. These mosquitoes don't like the hot, dry sun and prefer the higher humidity at night. They transmit malaria, filariasis and heartworm. Nclex mosquitoes are most active during the few hours after sunset. Domestic and wild birds are preferred hosts, over man, cows, horses or other mammals. They prefer lying in wait for their hosts in the thick leafy areas of trees where birds are found to nest and roost. They can also be found in tree trunks and animal dens. They transmit West Nile virus, encephalitis, filariasis and avian malaria. Why mosquito bites itch? The saliva contains enzymes and proteins that bypass your body's natural coagulation system. These anticoagulants, along with up to 19 other enzymes and proteins, directly cause the allergic reaction in your body. Your body's immune system responds to these allergens by releasing histamines. Some scientists believe that your very first mosquito bite introduced these allergens to your body and sensitized you to the components of the saliva. This sensitization is responsible for your body sending immunoglobulins to the mosquito bite. Immunoglobulins break down connective tissue and mast cells, which actually release the histamines that make you itch. Mast cells help heal wounds and defend against pathogens, but they play a big part in allergic reactions and inflammation. The histamines they release are commonly combated with antihistamines, which work to stop the itch. Life cycle of a mosquito. Eggs. Adult, female mosquitoes lay eggs on the inner walls of containers with water, above the waterline. Eggs stick to container walls like glue. They can survive drying out for up to 8 months. Mosquito eggs can even survive a winter. Mosquitoes only need a small amount of water to lay eggs. Bowls, cups, fountains, tires, barrels, vases, and any other container storing water make a great nursery. Larvae live in the water. They hatch from mosquito eggs. This happens when water, from rain or a sprinkler, covers the eggs. Larvae can be seen in the water. They are very active and are often called wigglers. Pupae live in the water. An adult mosquito emerges from the pupa and flies away. Adult female mosquitoes bite people and animals. Mosquitoes need blood to produce eggs. After feeding, female mosquitoes look for water sources to lay eggs. A. Aegypti and A. Albopictus don't fly long distances. In its lifetime, these mosquitoes will only fly within a few blocks. A. Aegypti mosquitoes prefer to live near and bite people. Because A. Albopictus mosquitoes bite people and animals, they can live in or near homes or in neighboring woods. A. Aegypti mosquitoes live indoors and outdoors, while A. Albopictus live outdoors, scents that repel mosquitoes. Citronella, basil, peppermint, garlic, rosemary, lemon balm, lemongrass, lavender, neem, marigold, catnip, bergamot, eucalyptus, essential oils for mosquito bite relief. Peppermint oil can have a cooling sensation which will distract your body from the itch. Tea tree oil is antibacterial, antifungal, and anti-inflammatory. This oil can be applied directly to skin, but some might find it dries out the affected area too much. Lavender oil is known for its soothing effect. And mosquitoes hate the smell, so it can prevent future bites, too. Rosemary oil, similarly to lavender oil, can also be effective in repelling mosquitoes for a short time. Chamomile oil is another multifaceted fighter against inflammation and infection. Extra bonus, make some chamomile ice cubes by brewing chamomile tea, then freezing it in an ice cube tray. The cold combined with the chamomile will help soothe the itch. High fever, cough, runny nose, maculopapular rash, and Nclex spots are seen in which of the following viral infections? A. Epstein-Barr. B. Mumps. C. Measles. D. Scarlet fever. The answer is C. Measles. Nclex spots are oral lesions seen early on in infection with the measles virus. These spots are only present in a minority of cases, though. Other common symptoms of measles include high fever, often over 104 degrees Fahrenheit, cough, runny nose, and a maculopapular rash which begins at the hairline and spreads down to the trunk and extremities. The most noticeable symptom in mumps infection is enlargement of the parotid glands, while Epstein-Barr infection can result in fatigue, lymphadenopathy, and hepatosplenomegaly. Scarlet fever is not a viral infection, but rather is caused by the bacteria Streptococcus pyogenes. How is the measles virus primarily spread? A. Contaminated blood. B. Insect vectors. C. Fecal oral. D. Respiratory droplets. The answer is D. Respiratory droplets. The measles virus is one of the most highly contagious of all childhood exanthems. It is spread primarily by respiratory droplets, or by touching a surface that has been in contact with an infected individual's saliva or mucus. It is not spread in feces, nor is it blood or vector-borne. Which of the following is an infection of the finger, toe, or nail cuticle with the herpes simplex virus? A. Infectious panichia. B. Herpanina. C. Herpetic panichia. D. Herpetic whitlow. The answer is D. Herpetic whitlow. An infection of the finger, toe, or cuticle with the herpes simplex virus is known as a herpetic whitlow. This infection causes painful swelling and erythema at the site of contact and is often caused by the finger coming into contact with a cold sore, oral herpes simplex lesion. It is more common in individuals who are frequently in contact with oral mucosa, such as dentists and dental hygienists, nurses, and in individuals who bite their nails or suck their fingers or thumb. Which of the following is the most common cause of infectious neonatal hearing loss? A. Cytomegalovirus. B. Measles. C. Epstein-Barr virus. D. Chlamydia. The answer is A. Cytomegalovirus. The most common cause of infectious hearing loss in neonates is cytomegalovirus, CMV, also known as human herpes virus 5. While this disease rarely causes symptoms in adults, it can cause significant harm to a fetus. One of the primary fetal consequences of CMV infection in pregnancy is hearing loss. Other issues can include vision loss, developmental delays, and seizures. Cytomegalovirus, CMV, belongs to the family Herpesviridae and causes cytomegalovirus mononucleosis, cytomegalic inclusion disease, and cytomegalovirus infection in the immunocompromised. CMV resembles infectious mononucleosis in that atypical lymphocytosis, fever, and malaise are characteristic symptoms to both. Pharyngitis is present as a symptom, though less severe in CMV than in infectious mononucleosis. The heterophile antibody test is also negative in CMV. Toxoplasmosis may also mimic CMV and infectious mononucleosis and thus must be considered in the differential diagnosis in those patients with a negative heterophile antibody test and mono-like symptoms. Transmission of CMV from mother to fetus may occur at any time during the pregnancy. Fetal loss is less likely than congenital CMV infection, which, in its most severe form, is manifested as hepatosplenomegaly, microcephaly, chorioretinitis, hearing loss, and thrombocytopenia. The mortality rate is high. CMV is common. Most common virus transmitted from a pregnant woman to her unborn child. 1 in 150 children are born with congenital CMV. 1 in 3 pregnant women who get CMV will pass the virus to their unborn child. CMV is more common than 29 combined metabolic and endocrine disorders in the recommended U.S. newborn screening panel. Second children are more likely to be born with CMV. Because mothers are more likely to be exposed to CMV picked up by their own children in daycare or playgroups, women are more likely to contract CMV the second time they get pregnant, a bad thing considering the virus can do the most damage to a fetus when a woman is infected for the first time during her pregnancy. A father brings in his 7-year-old son for bumps all over his arms and trunk. On examination, the nurse sees 20-30 small, 1 to 5 millimeters, flesh-colored, dome-shaped papules. They are pearly and several have dimpled centers. They are not itchy, crusting, or painful. These lesions are most likely which of the following? A. Common warts. B. Chicken pox. C. Molluscum contagiosum. D. Herpes simplex. The answer is C. Molluscum contagiosum. The lesions described are most likely Molluscum contagiosum, caused by the Molluscum contagiosum virus. Molluscum contagiosum generally present as 1 to 5 millimeters papules that are flesh-colored and dome-shaped. The dimpled center may or may not be visible on papules, though this is considered pathognomonic for the virus. Common warts may present with a similar appearance, but will not generally present in such high numbers and don't have a dimpled appearance. Chicken pox lesions will generally be red and weeping or crusting, and herpes simplex lesions are not commonly seen outside of the oral mucosa, genital area, or fingers. Which of the following viruses is the most common cause of febrile seizures? A. Parvovirus B19. B. Measles virus. C. Human herpes virus 6, HHV6. D. Epstein-Barr virus. The answer is C. Human herpes virus 6, HHV6. The majority of febrile seizures are caused by viral infections, with the most common virus involved being human herpes virus 6, or HHV6. What is the incubation period for infectious mononucleosis? A. 7 to 14 days. B. 14 to 28 days. C. 2 to 3 days. D. 30 to 50 days. The answer is D. 30 to 50 days. Infectious mononucleosis, a condition caused by Epstein-Barr virus, has a very long incubation period. Onset of the disease is typically 30 to 50 days after the time of initial infection. Epstein-Barr virus belongs to the family Herpesviridae and is the causative agent of infectious mononucleosis, Burkitt's lymphoma, and undifferentiated nasopharyngeal carcinoma. Infectious mononucleosis characteristically produces a marked lymphocytosis involving almost all of the lymphoauricular tissues. This leads to hepatomegaly, splenomegaly, lymphadenopathy, and lymphoid hyperplasia of the oronaesopharynx. The peripheral blood smear contains atypical lymphocytes of the Downy 2 type. It is generally a self-limiting disease, however, it can cause a severe protracted illness that can at times prove to be fatal. Patients with an unusual immunodefect known as the X-linked lymphoproliferative syndrome frequently have overwhelming EBV primary infections, which can be fatal in the majority of the cases. Bell's palsy is associated with a reactivation of which of the following viral infections? A. Herpes simplex 1. B. Cytomegalovirus. C. Varicella zoster. D. Rotavirus. The answer is A. Herpes simplex 1. Bell's palsy is associated with reactivation of herpes simplex 1, a human herpes virus that can exist in latent form in the dorsal root ganglia of nerves in the head and neck. Reactivation of the virus causes the temporary unilateral facial paralysis associated with Bell's palsy.